Many women suffer from the distressing problem of stress urinary incontinence. This is a condition in which every time they cough or sneeze or laugh, there is leakage of urine which is involuntary. This is extremely distressing a problem because it disrupts her social life. She is not able to go out for work, go out actively, is scared to laugh in public or sneeze because there is a leakage of urine. There's a lot of odd smell because of that. She's often having to wear diapers to prevent this urinary leakage. This can happen in women in the age of 30s, in the 40s, 50s and onwards. Usually seen in women who've had normal deliveries, because a normal delivery causes a lot of stretching of the pelvic floor muscles, causes weakness of the bladder supports in certain cases, particularly if it's a large baby, if it's a difficult delivery, or there's been a vacuum or forceps application, or the patient has had a number of children. These women usually start weakness of the bladder supports of the vagina and often have an accompanying prolapse or a coming down of the uterus and the supporting structures. The diagnosis is usually brought about by the patient herself because she comes with those symptoms. We can do specific tests called urodynamic studies, whereby the exact time and the pressure at which the urine leaks is found out. Whether there's any other accompanying problem in the urinary bladder can be found out by this urodynamic study. There is now certain medical therapies available for stress urinary incontinence, but obviously the patient has to take this tablet every single day for as long as she wants relief. Women are often not ready to take long-term therapy because of the side effects which are associated with it. And therefore, surgical treatment is usually the mainstay of treatment of SUI. Surgical therapies are very diverse. There are many different therapies and each individual patient has to be individually targeted for a particular surgery. In the earlier days, just a tightening in and around the urinary opening, which is a Kegels repair, was done. But nowadays, there are a lot of excellent vaginal surgeries such as TVT, that is tension-free vaginal tape, or tension-free vaginal tape obturator approach, which is being done. This TOT procedure involves a tiny cut in the vagina just underneath the urinary opening, and a tape is placed just below the urinary opening. This helps to tighten or close the urinary opening every time the patient strains or coughs or sneezes. So instead of the urine coming out, at that point the urinary opening closes and the patient is able to control urine completely. This procedure takes about 15 minutes to perform. Patient stays in hospital for just a day and can go home the next day. This surgery can be combined along with tightening of the vagina or of the bladder or rectal supports if necessary. In some patients, there may be still the requirement of an open or a laparoscopic surgery, such as a Bursch operation, if there is a major or a recurrence of stress urinary incontinence. But most people do extremely well with these tape procedures for the treatment of SUI.